The respiratory and circulatory systems of racing pigeons are finely tuned to meet the extreme physiological demands of flight. As pigeons fly at speeds averaging 50 to 60 miles per hour during a race, their oxygen consumption can increase up to 15 times the resting rate during normal training flights, and up to 30 times when battling headwinds. To handle these skyrocketing energy requirements and prevent fatigue, maintaining excellent respiratory and cardiovascular health is crucial. Respiratory system. The avian respiratory system has unique adaptations that allow high oxygen uptake during flight. Birds have bellows-like air sacs that increase ventilation efficiency and permeate the body, invading bone and muscle tissue. This system of 9 interconnecting air sacs delivers oxygen directly to tissue capillaries while extracting carbon dioxide, enabling gas exchange during both inhalation and exhalation. In pigeons, the efficiency of the parabronchial lung and air sac system allows meeting the oxygen demands of extreme exertion. Pigeons take approximately 25 to 30 breaths per minute at rest. During flight, this respiratory rate increases substantially to supply adequate oxygen to the working flight muscles. The oxygen consumption levels achieved by racing pigeons exceed that of the most elite human athletes. Respiratory disease impacts on performance. Given the respiratory system's vital role, diseases that compromise the air sacs or parabronchial lungs can severely impact a pigeon's athletic performance. Inflammation, scarring, or infection of the air sacs reduces their bellows-like action that ventilates the lungs. Impaired lung function hinders oxygen delivery to muscle tissue, resulting in premature fatigue, muscle cramps, and inability to sustain speed and endurance. Common respiratory infections in pigeons include paramyxovirus, targets the epithelium of the parabronchial lung, causing pneumonia. Survivors develop irreversible lung damage. Ornithosis, chlamydia infection causing air saculitis, an inflammation of the air sacs. Impedes oxygen exchange. Aspergillosis, fungal infection of air sacs leading to labored breathing. Laryngotracheitis, viral infection of upper respiratory tract that can spread to air sacs. Any inflammation or obstruction in the upper airways also reduces athletic performance. Nasal cavity infections, sinusitis, rhinitis, conjunctivitis, and tracheitis negatively impact a pigeon's ventilation, temperature regulation, and endurance. Panting. During intense flights or competitions, overheating is a risk. Pigeons lack sweat glands and rely on rapid respiratory evaporation as their primary heat dissipation mechanism. Panting increases evaporative cooling but also has downsides. The open mouth breathing causes water loss, and the rapid respirations can result in respiratory alkalosis from blowing off too much CO2. While panting is a normal response in healthy pigeons at high exertion levels, excessive or chronic panting can signal underlying issues. Respiratory infections, inflamed and obstructed upper airways inhibit normal temperature regulation. Overtraining, panting from exertional heat strain indicates the need to back off on training volume/intensity. Overweight, excess fat impedes heat dissipation. Heart disease, poor circulation reduces heat dispersion. Dehydration, water loss from panting exacerbates overheating issues. Breeders must be able to distinguish between normal exercise panting and problematic panting indicative of illness or overexertion. During competition season, the upper respiratory tract should be carefully inspected for any abnormalities. Circulatory system. The circulatory system must also adapt to accommodate the cardiovascular demands of flight. A pigeon's heart rate increases from around 180 bpm at rest to over 600 bpm during racing flight. Cardiac output escalates from 20 milliliters per minute to over 300 milliliters per minute. This expanded pumping capacity rapidly delivers oxygen and energy to the skeletal muscles. Specializations of the avian cardiovascular system to meet these demands include larger heart size relative to body mass compared to mammals. The pigeon heart accounts for 13% of total body weight. Thicker ventricular walls with increased cardiac muscle mass to generate greater contractile force. Higher hematocrit counts averaging 50% compared to humans' 40 to 45%. This maximizes oxygen carrying capacity. Nucleated red blood cells allowing higher metabolic activity and oxygen release. Capillary beds surrounding and permeating the flight muscles to maximize oxygen diffusion. Cardiovascular diseases impacting performance. Given the heavy cardiovascular demands of racing flight, circulatory diseases can significantly impact performance. Heart conditions such as myocarditis, endocarditis, cardiomyopathy, arrhythmias, and valvular disease reduce cardiac output. Blood parasites like leukocytozoon and trypanosoma can cause anemia, limiting oxygen transport. Atherosclerosis is a common condition where fatty plaques accumulate in arteries, obstructing blood flow. This not only reduces oxygen delivery but also impedes heat dissipation from the flight muscles. Pigeons with heavy atherosclerotic plaques in the carotid and intercostal arteries overheat faster and fatigue prematurely. Monitoring fitness and screening for circulatory issues are key to maximizing racing potential. Heart rate recovery time after flights provides insight into cardiovascular conditioning. The heart should return to under 100 BPM within 10 minutes of landing. Elevated recovery heart rates can indicate poor fitness or underlying disease. Throat examination. Throat examination provides an excellent non-invasive assessment of a pigeon's respiratory status and circulation. The throat contains a thin membrane called the glottis curtain separating the oral and nasal cavities from the trachea. This curtain is highly vascularized with a rich blood supply, making it an ideal indicator of respiratory health and circulatory function. In a strong, healthy pigeon, the glottis curtain should appear pink in color. Paleness could indicate anemia or impaired perfusion. Moist appearance, dryness may signal dehydration or respiratory inflammation. Fine texture, heavy wrinkling could show infection or edema. Inflammation-free, swelling, redness, or mucus are abnormal. Proper width and position, abnormal openings may indicate disease. This curtain is very reactive to the bird's condition. Stress, illness, overtraining, circulatory issues, and respiratory infections can all manifest as changes in color, texture, position, and appearance. When evaluating the throat, it is important pigeons are fully rested and relaxed. Factors like mating, molting, young age, or recent exertion make the throat an unreliable gauge until the bird normalizes. Patience and keen observation are required to properly interpret the throat. With experience, breeders can effectively assess respiratory power, endurance capacity, fitness, hydration status, stress level, and circulatory function from a quick throat check. This provides invaluable insight into the bird's preparation for upcoming races and can reveal underlying health issues requiring intervention. Optimizing respiratory and cardiovascular function. To achieve elite racing performance, pigeons must have impeccable respiratory and cardiovascular function free of disease or impairment. Some best practices for optimization include annual vet check screening for infection and circulatory issues. Testing can include blood panels, X-rays, ECG, endoscopy, etc. Avoiding respiratory irritants like dust, ammonia and mold in the loft environment. Maintaining excellent loft ventilation and air quality. Gradual conditioning with interval training to develop cardiovascular capacity. Close monitoring of respiratory rate and effort during workouts. Supporting heart health with omega fatty acid supplementation. Ensuring adequate hydration before, during and after flights. Allowing proper rest and recovery between intense training sessions. Reducing stress. Chronic stress elevates heart rate and respiratory rate. The avian respiratory and circulatory systems are engineering marvels allowing the incredible athletic feats pigeons can achieve. When these systems are perfectly tuned, pigeons have the gas exchange, oxygen carrying capacity, and cardiopulmonary reserve to excel in the challenges of racing flight. Careful breeding, management, training, and healthcare are key to realizing the genetic potential of these physiological systems. With proper optimization, the sky is the limit for racing pigeon performance.
There are many reasons to buy my racing pigeon method. Here are some of the best reasons. You will get excellent results. It's a very simple system to use. It's affordable. I have had over 400 first prize winners. It's adaptable to any situation. You can use it with any racing method, natural, widowhood, young birds. It's a very effective method. There is no need to spend a lot of money on fancy pigeon products. It's a reliable system and it is foolproof to use. Professional athletes, race horses, take the same products. There is science behind this, not just hearsay. It is all to do with red blood cells and oxygen in the blood. Without that, a pigeon will not race well, or an athlete will not win a race. If he has low oxygen in his blood, the above is fact and is 100% science. There are a few things you can do to improve your chances of winning at racing pigeons. One of the most important things is to learn as much as you can about the sport. You'll need to know the different types of pigeons, how to train them, and how to race them. Another key factor is practice. You'll need to be able to fly your pigeons competently in order to win races. And, of course, you'll need to have the funds to invest in racing pigeons and other racing equipment.